Okay, so the purpose of this video is to show you how to set up when you are doing a subtraction run for a vascular case. There are quite a few doctors that we work with that ask for you to do subtraction. I'm not going to name all of them, but just know that if they ask for subtraction, this is what they're going to need. And some of them may also call it DSA, which I believe is digital subtraction angiography, but don't quote me on that. And we're going to be doing this demo on a GE OEC Elite C arm. So first of all, I'm just going to kind of explain why we do digital subtraction. Okay, when they shoot dye through a vein, sometimes the bones and other things can interfere with them being able to see the vein by itself. So when you use digital subtraction, it sees the blood vessel with the dye in it and then subtracts everything else out of the image. Okay, so the doctor may ask you for just regular fluoro, and that's going to just be this button right here, or on the remote it will be this button right here, this one. If they ask for digital subtraction or DSA, first you're going to have it in vascular if you're doing a vascular case. And then if they ask for DSA, you're going to set it up like this. You're going to go here. Where it says fluoro and high-level fluoro, you're going to click on mode. And it should change it to subtraction. If it does not, sometimes it may be on something else like roadmap and subtract. You're going to want it to say fluoro and subtraction. So if you need to click this again and just kind of scroll through those. Okay, right here it says fluoro and high-level fluoro. These right here refer to the buttons on your remote. And all you're going to do for subtraction is hit this mode button, and it should say fluoro and subtract. So now those buttons on your remote, this would be fluoro and this is subtraction. And when you do subtraction, it's going to automatically record at 15 frames per second, and you're just going to leave it there. So the doctor may have you fluoro to make sure you're in the right spot, and when they're ready to shoot dye, they will tell you subtraction or DSA. And for that, you're going to push this button right here. Okay, so we've got it set up for subtraction, and if we took a regular x-ray, we would be able to see, like, let's just pretend like this is a bone and this is the vein. Normally you wouldn't be able to see the vein, but because it's plastic, we can see it a little bit. So I'm going to grab the remote, and if she tells me, okay, go ahead and start subtracting, I'm going to push this button and the screen will turn white, and once the screen turns white, then she will start pushing the contrast. So, okay, go ahead. There we go. So as you can see, it got rid of the scissors because it didn't think that was a blood vessel, and now we're only seeing the blood vessel as the dye is going through it. Okay, so after you do the subtraction run, it will automatically play back, and you can pause it right here if they want to look at it, or you can push that again for it to keep playing through. If they ask you for road mapping, that is something where they can see where the dye was without having to shoot dye again. And you have to do a subtraction run first, and then you're going to hit peak. Once you hit peak, it will fill up the blood vessel with the contrast, and then you're going to hit pause. And after you hit pause, you're going to hit this button right here. So it's not going to look like anything, but the next time that you fluoro with regular fluoro, it will basically show a map of where the dye was without having to reshoot the dye. And sometimes they'll ask you to road map something and then they'll say fluoro, and when you fluoro with the regular fluoro button, it will have the road map on there. And if you want to get rid of the road mapping, you're going to go here. And so now we're on road map and subtract. You're just going to change this to regular fluoro. Sometimes they don't use road mapping. They don't always use it, but if they ask for it, that's how you do it.